If you or a loved one has an autoimmune condition, like rheumatoid arthritis, lupus, Hashimoto's thyroiditis, Crohn's disease, ulcerative colitis, there are steps you can take to prevent or even reverse an existing autoimmune condition. And I mean without drugs. The drugs are, by the way, horrible. They're full of side effects, horrible side effects. I mean really serious side effects like liver failure and cancer. While you have access to some very powerful methods that minimize or even eliminate an autoimmune condition. We start by eliminating the initiating factor in most autoimmune diseases, the gliadin protein of wheat, and related proteins in other grains, the casein of rye, the hordein of barley, the zein protein of corn. These proteins are known to initiate an increase in intestinal permeability. They actually separate the intestinal cells and allow foreign substances to gain entry into the bloodstream. Well, that could be foreign substances that trigger an immune response that in turn cause your immune system to attack your own organs. It can also increase the levels of factors like lipopolysaccharide. These are bacterial breakdown products that even in minuscule amounts in the bloodstream are extremely inflammatory. So the gliadin protein and related proteins in other grains initiate the process of autoimmunity in many, if not most, people with autoimmune diseases. Likewise, to a lesser degree, the casein beta A1 protein of dairy is known to be a trigger for autoimmune diseases such as type 1 diabetes and in children and rheumatoid arthritis. A workaround would be to avoid casein beta A1, which is very common in North America, and look for the A2 milk or goat and sheep sources because they have the A2 protein that's identical to the human form and thereby much less immunogenic. Or also you can ferment your dairy. If you ferment like our yogurt, our Lactobacillus rhodori yogurt, where we ferment for an extended time period, we maximize the conversion of lactose, the lactose sugar, to lactic acid, which thereby drops the pH of your yogurt to the 3.0, 3.5 range, very acidic, that's why it's so tart. And that much acidity denatures or breaks down the casein beta A1. It doesn't eliminate it, but it minimizes the troubles from casein beta A1. Now, an easy way to think about autoimmune diseases is to think of initiating causes like the gliadin protein of wheat and what I call permissive causes, factors that allow an initiating event to develop into an autoimmune condition. Vitamin D deficiency, a big permissive factor. So if you're deficient, it allows type 1 diabetes to take root or rheumatoid arthritis to emerge. So getting your vitamin D perfect is very, very important. What we do is we aim for a 25 hydroxy vitamin D blood level, 60 to 70 nanograms per milliliter. That's what we aim for. And that is an area, that's a range in which we minimize the potential for autoimmune diseases and maximize the potential for reversing an existing autoimmune condition. We do that with oil-based gel caps only. While not as powerful, a deficiency of omega-3 fatty acids can also facilitate the emergence of an autoimmune condition if something else initiates that process. So what we do is we used to aim for what's called an RBC omega-3 index, a blood test, of 10% or greater. That is, we want at least 10% of the fatty acids in the red blood cell membrane to consist of omega-3 fatty acids. Well, you could test that, make that test, an RBC omega-3 index, or you could just take the dose that we know achieves that level, which is 3,600 milligrams of EPA and DHA per day. And by the way, it can only come from fish oil. It can't come from krill oil. It can't come from flaxseed oil or other sources of linolenic acid. It must come from fish oil only. And then there are causes that are both. That is, they are initiating and they're also permissive. And that would be small intestinal bacterial overgrowth, or SIBO, and possibly small intestinal fungal overgrowth, or SIFO. These are situations that represent severe disruption of bowel flora, dysbiosis, in which the bacterial species have shifted towards organisms like Campylobacter and E. coli, and they have also ascended up from the colon into the ileum, jejunum, duodenum, and stomach. And this represents a massively inflamed situation associated with increased intestinal permeability. So it can both initiate an autoimmune disease and it can perpetuate or facilitate the emergence of an autoimmune disease. Correcting these situations is not that difficult. Unfortunately, you cannot count on most doctors to help you because sadly they're often 20 or 30 years behind the times because they were trained many years ago. And if you said, hey doc, I think I have SIBO, he says, I don't know what you're talking about. Don't worry about it. Doesn't apply to you. There's no such thing. I've even heard that from my colleagues. Or they send it to a gastroenterologist who wants to very eagerly perform an endoscopy and a colonoscopy and declares you fine because he can't see anything at the end of his scope. And you say, well, what about my SIBO question? Don't worry about that. That's stupid. So you're unlikely to get smart answers, informed answers from most doctors. So you can manage this on your own. Take a look at my video called Telltale Signs of SIBO. It's on YouTube, it's on my Wheat Belly blog, it's on my Undoctored blog, and then you can take the steps to manage it. Though that does take a little bit of support. That's what we do in our Undoctored Inner Circle program. We talk to you via video and show you how to correct it, give you some feedback whether you're doing it right or doing it wrong, but it is something you can manage on your own. So there you have it. These are the factors, the biggest factors. There are others, but less common, but these are the big factors that apply to autoimmune conditions that you can do something about.